I'm Brooke, and I'll be your provider today. What brings you in?
I'm having some abdominal pain. It's mostly in like my right lower area. I don't really have an appetite, and I've noticed some weight loss, and I've also had some diarrhea with blood in it.
Okay, I'm sorry to hear that. It sounds like your assessment today will be GI focused. I'll have you lay flat, which you are already doing, and I will begin the assessment. I'm going to begin with inspection. I'm going to slide this over. I'm checking for symmetry, contour. It looks like your contour is flat. I'm looking at the umbilicus. I'm looking for inflammation or bulging, and I see no obvious aortic pulsation. Okay, moving on to auscultation. I will listen to your bowel sounds in all 4 quadrants first. Okay, so you have normal active bowel sounds in all 4 quadrants. Next, I will listen for any bruits, beginning with the aorta. Renal. All right, no noted bruits in the aorta, the renal, the iliac, or the femoral. Okay, next I will be using percussion. I'll be percussing all 9 areas. I'm going to be percussing for tympani and for dullness. All right, there was no dullness noted. Next, I will measure the span of liver dullness at the right midclavicular line. All right, and that was 12 cms, which is normal. Next, I will assess for splenomegaly. I'm going to have you turn towards me a little bit. You can just shift. Okay. And I'm going to have you take a deep breath. And there is no evidence of splenomegaly. Okay. Next, I will be moving on to palpation. Doing this, I have him laying flat with a pillow behind his head, and I have a pillow behind his knees also. The first thing I'm going to do is begin palpating. I'm using light palpation right now.
That's a little sore right there.
Okay, so he did say that was a little sore, so I would make note of that. Right lower quadrant. Okay, now I will move on to deep palpation.
That's definitely sore.
Okay, so it's sore to light palpation and deep palpation. I'll make note of that and I will check for rebound tenderness. Okay, I'm going to push in and then I'm going to push out and let me know if it hurts more when I push in or when I push out.
Yeah, it hurts more when you push in.
When I push in, okay. So I would note that there is no rebound tenderness noted. Okay, next I will begin with palpating your liver. I'm going to have you turn to your left side for me. I'm going to take one hand and put it on your back, and I'm going to have you take a deep breath in and out. Okay, and your liver is not enlarged. Now I'll have you turn back around and lay on your right side for me. And I'm going to palpate your spleen. Sorry, we take a deep breath in and out. Okay, the spleen is not enlarged. Next, I'm going to have you lay on your back again for me. And I'm going to assess the aortic width. Okay, it is about 2.5 centimeters, which is normal. Okay, now I'll be moving on to a specialty test. The first thing I'll have you do is sit up for me. Okay, that's good. I'm going to come behind you. And do you have any tenderness?
No.
Okay, then you can lay back down. Whoops. Okay, the next thing I'm going to do is check for ascites. Okay, I notice no fluid, there's no wave, and there's no shifting. Okay, next I will be checking for appendicitis. I'm going to press in and you tell me if there is any tenderness.
No.
No tenderness? Okay, then I will have you move to your left side, if you can turn for me. That was a negative Rossing sign. Okay, I'm going to have you extend your legs. Can you lay them straight out? And I'm going to take this top one and I'm going to bring it back. Does it hurt?
No.
Okay, so that's a negative SOA sign. Next, I'm going to have you lay on your back again for me. And then, can you lay your legs straight? Will you give me one of your legs, please? Will you bend it? Is there any tenderness here?
No.
Okay, that's a negative operator sign. Okay, so the next thing I will do, and the last thing I will do, is check for a Murphy sign. So I'm going to press in, deep breath in for me, deep breath out. I'm just pressing. Is there tenderness there?
No.
All right, well that was a negative Murphy sign. Based on your exam findings, I'm suspecting Crohn's disease. I'm going to refer you to a gastroenterologist for further testing.